Iyer, and I have the great privilege to oversee the Baltimore Neighborhood Indicators Alliance at the University of Baltimore. And this is the 12th annual Baltimore Data Day/week. It's normally just a day, but since we're all still remote during this pandemic, we're calling it Baltimore Data Week. And to give some words of welcome from the University of Baltimore, I want to turn it over to our Dean of the Merrick School of Business, Dean Murray Deal.
Thank you, Seema, and welcome everybody. This is a really important week for us. It used to be a day, as Seema said, but it's a really important week for us. As our president, President Schmokoffen, reminds us, we're not only the University of Baltimore, we're the University for Baltimore, and we feel that we've got to do more than just making that a marketing slogan. We see that we should be agents of change in Baltimore itself, and being agents of change means several things. Most importantly, I think it means that we have to be collaborators with people like yourself who I think love Baltimore. I mean, you may have guessed this by now. I didn't grow up in Baltimore. I came from slightly east of here, but I love Baltimore. But to be an agent of change who loves Baltimore, I think we need even more, and we need things that are substantive. And data is so important to bringing about change, and that's why the Baltimore Neighborhood Indicators Alliance project is so important. And this week is a week where we can share, we can collaborate, we can discuss, we can stimulate action, and we can improve on how we do this also in future years. So I encourage you, as well as this session, to go to the other sessions that are on the website. Thank you, Seema, for leading this, and Cheryl for managing it. Thank you also to all of our sponsors who Seema is going to introduce, and also thank you all for participating in this. So Seema, thank you for asking me to attend. Over to you.
Thanks so much, Dean DL. All right, so welcome everybody. We are going to make this as interactive as we can, even though it is a webinar. So first up, you all are seeing who's in the audience, and it is exciting to see everybody, at least virtually. Normally, Baltimore Data Day is a day where we all kind of commune together. There's lots of hugs. So we're giving you all virtual hugs. And let us show you who's in the room. We have folks predominantly that work in Baltimore or live and work in Baltimore. And we have folks that are from the public sector, university, nonprofit organizations, and community leaders. So thank you all for being here. And we are going to start with a quick overview of what we've learned during the Baltimore Vital Signs Report release, which we did kind of slowly over the course of the last couple of months. I'm going to share my screen here. Everybody's seeing the full screen? Hopefully. All right, so here's a little agenda for today. Give me a thumbs up if you can actually see the full screen. Sometimes I can't tell. All right, thank you. All right, so we're going to talk a little bit about who we are. What do we know about data from 2020? Trends pre-pandemic leading into 2020, which is the vast majority of what you're going to see with Vital Signs 19. And then talk a little bit about key indicators that we've identified over the past couple of years that we might want to think about looking at post-pandemic. Giving you a preview of Baltimore Data Week, a website demo, and then Cheryl's going to give an open data portal tour, which is very new this year and very exciting for us to share a great partnership that we now have with the city of Baltimore. So if you do have a device where you can follow along, it'll be really interactive. You can literally see what I'm showing you online as we go, and maybe some of your questions will stem from that as well. All right, first of all, of course, as Dean DL said, thank you. I want to thank, obviously, the BNIA team. Cheryl Knott, who you're going to hear from later, is our research manager. Logan Schertz Carlos Carpati, Brittany McMullen. And then we have a whole suite of data science fellows that join us every semester. It started last year. It's a great data science fellows program, which you'll be able to learn more about if you come with us on Thursday. And our students this year are Caitlin, Amavi, Loveth, and Priya. And Priya is double dutying it this time to do both our day-to-day intern as well as doing the data science. So thank you, Priya, for being with us. And of course, the University of Baltimore itself gives us plenty of support in order to put on an event like this. We're not exactly event planners, although we've gotten good at Baltimore Data Week. So thanks to Jared, Wendy, James, and of course, everybody at the Dean's office for helping us promote the event. Oh my goodness, where am I going? We always have great partners with the Federal Reserve Bank of Richmond. You're going to hear a session that they've curated on Wednesday. And then, of course, we've had lots of great support from our sponsors this year, including, PNC Bank, JP Morgan, Stalwarts and T. Rowe Price and the Annie E. Casey Foundation, Kaiser Permanente and LifeBridge Health and Fulton Bank. And then also we have had great partnerships to attempt to do some hybrid sessions, not completely virtual. We have a few sessions that will have an in-person option if you are interested, with the library and with the brand new D Center, which is downtown. So if you're interested in that, please put that in the chat and we'll send you ways on how to come in person to some of our sessions later on this week. The entire week, all of our panelists are volunteers, so thanks to them for joining us. Moderators and workshop leads, we've got amazing workshops, very interactive workshops that are going to show you how to use our APIs, how to access census data. So that's fantastic. And of course, thanks to all of you for being with us. For some of you, this may or may not be your first Baltimore Data Week. Hopefully, many of you are return customers. You've been with us in the past. And for those of you that have been here brand new, this is the first time you're joining us, welcome. Hopefully, this is the first of many data weeks that you will be with us. And hopefully in the future, it'll be more in person. All right, a little bit about who we are for those that are not familiar. The Baltimore Neighborhood Indicators Alliance has been around now for 21 years. We started back in 2000. We are here in order to put out data for us all to measure and track progress for our neighborhoods. This is the goal. It's not just about having data, it's about to hold ourselves all accountable for moving our city forward and making sure that every neighborhood has an increasing quality of life. And that's what we're here to do, is put out data. We're part of what's called the National Neighborhood Indicators Partnership, which is a learning network of more than 30 cities around the country, hosted by the Urban Institute in Washington, DC. And our job is both to kind of push out our learning from Baltimore and then bring back learning from other cities and bring it back to Baltimore. It's been an amazing partnership over the last 20 years. And you can learn more about that if you like on the neighborhoodindicators.org website. This is what we do. We put out the Vital Signs Report. This is the 19th edition, and obviously an unusual year. Normally, we would wait for an entire year's worth of data, put out all that data, and this is the 2019 version of the data. But it became very clear that since we had a little bit of 2020 data, we should put out as much 2020 information as we can so that we can all understand this unusual moment of disruption, really, that we've all had. Every single one of our neighborhoods that experience all kinds of different ways of disruption, and how can the data show us what some of our neighborhoods might be experiencing. We have these topic areas. There's over 110 indicators. I'm not going to do justice to all 110 in this webinar. We had done a series of webinars in the spring, releasing one chapter at a time. So if you want a deep dive into each one of the separate indicators or the separate chapters, feel free to take a look at our YouTube channel and you can see some of the webinars from the spring. But what I want to do today is kind of synthesize and show, like I said, what do we see happening during the pandemic? What led into the pandemic, and where could we potentially go post-pandemic? So what do we know about the impact of COVID-19? Obviously, from a health perspective, we've had lots of devastation in terms of the number of cases, the number of deaths, which is a tragedy for all of us in the city. But we now have at least 60% of all adults in the city of Baltimore with at least one dose of the vaccine, which is an amazing moment. If we think about where we were last year during Data Week, we could not have even foreseen that level of kind of opening happening. So that's very exciting, and congratulations to everybody in the health department and everybody in the health field that got us to this point. We have a lot way to go, but here we've certainly seen some progress. You're going to hear much more about the city's data on COVID-19 at 4 o'clock today, if you want to join us for that. This is just a little teaser for that. But what we have on our website is to try and understand the impact of the COVID-19 pandemic on our neighborhoods, and not just in the city of Baltimore, but also in the county. And this is the first time in our 20-year history that we were able to release data for Baltimore County as well. And that's very exciting. And Cheryl's going to be able to show you a little bit about our coronavirus data portal hub. What we do see very quickly from that visualization is that there was a disproportionate impact on neighborhoods, not just African Americans in general, but African American older households, older African American households, and also households with high Hispanic, so neighborhoods with high Hispanic households, which is predominantly in the Southeast. So we were very quickly able to stand up a visualization to show the kinds of neighborhoods that might be impacted by the coronavirus data portal, the coronavirus pandemic. In terms of the economy, we had a different kind of devastation, right? More than 9,000 low-income workers in Baltimore is estimated to have lost their jobs since 2020 of March, and unusual neighborhoods that might have experienced this kind of disruption. Loch Raven, Claremont, Armistead, Brooklyn, Curtis Bay, Hawkins Point, these are predominantly where we might have some of our working low-income workers living, and they might have gotten disrupted. This is an estimate from the Urban Institute based on some of the early releases of unemployment data that came out from the federal government. And then the Baltimore Metropolitan Council released their Baltimore Regional Recovery Dashboard, which, if anybody's interested, should basically take a look at that. And they estimate Baltimore City lost 60% of employees, specifically in the accommodation and food services sector, between April 2019 and April 2020. So overall, we've seen this devastation in our economy, and now we're obviously trying to come out of it. In terms of the housing market, that was a different story. For any of you that might have sold a house this year, we had lots of people basically rehabilitating their homes. So you can see in Baltimore City, we had the highest level of rehabilitation permit data in 2020. We are able to show a little bit of housing data from 2020. And also we recorded the lowest vacant and abandoned housing level in 2020 in the city, based on years of data that we received from our city housing department. And then the days on the market, the median days on the market in the city in 2020 was only 23 days. That's less than half of what it was in 2010. And it has slowly been declining, and then it became a pretty big drop in 2020. So a crazy housing market in 2020, but, and the good thing is that some of the rehabilitation had happened in some of our more farther flung, more stable neighborhoods, neighborhoods that might not have seen this kind of activity in the past. So you see a lot of rehabilitation permits in Forest Park and Dorchester, Ashburton, which is good news, because these are neighborhoods that would not have normally seen that kind of rehabilitation activity. We do still, unfortunately, have the pattern of vacancy, but in general, the citywide vacancy rate has gone down, and we've seen the lowest level in 2020. So some good news, but in terms of crime was way down in 2020, half of what it was in preceding years. And you can see kind of the trend over the last decade and a complete drop in 2020. But these are indicators that focus predominantly in the public realm, right? Robberies, burglaries, kind of big things that might happen where we have people outside to see these kinds of things happen. We don't know, for example, what might have been going on in the private realm in terms of domestic violence. There is some evidence that domestic violence was rising during the pandemic, but we don't have a way to track that. So this is a little bit of the story of you can only track what you're measuring. And that's why we're always on the prowl for better data to make sure that we don't have any missing statistics. And while this is an amazing statistic, Baltimore did in 2020 record the 6th year in a row for more than 300 homicides in our city, which makes us one of the highest homicide rate cities in the nation. We had some of the lowest property crime, like robberies and burglaries and those kinds of things in the nation, but unfortunately some of the highest violent crime in the city. So very interesting dichotomy of what went on during the pandemic for different neighborhoods and for different kinds of folks living in our city. So that's where we were in 2020. That's a little bit of the data that we have in 2020. But what was happening leading into the pandemic? So where were we as a city kind of coming into the pandemic? So this is all 2019 data and trend data coming into 2019. Let's start off with some good news. In terms of health, the teen birth rate in the city of Baltimore was half of what it was in 2010 by 2019. And if we looked way back when Bina started back in 2000, this is about a quarter of what it was back in 2000. And when we think about teen birth rates and why this idea of measuring and tracking and sustaining that level of tracking for 20 years is not only to show the good news that we now have a quarter of the rate of teen births in the city than we did when we first started in 2000, but to also reflect on how this could have happened, right? It's not that there was one agency that can claim responsibility or credit really for this level of decline. It's all of us working together. The city had created the Be More for Healthy Babies initiative back in 2000 to really address this issue. And you can see that slowly, methodically, kind of collectively, the results of that work we can track, looking at making sure that there was health related to teenage birth. There was education for girls in this age range. There were other opportunities and engagement opportunities for girls in this range. And the results you can see. And of course, on our website, you can see the neighborhoods that are being impacted by this kind of result and the trends in different neighborhoods. So in different neighborhoods like Brooklyn Curtis Bay, which is that top green line, that is seeing both a decline, but then a slight increase. And so when we want to target efforts over the city for different neighborhoods, this is the kind of data that hopefully is useful to that collective group of people that is working on this kind of work. The other good news is that we now have seen the lowest level of lead paint, lead levels in blood. This is something that gets tracked for children. Again, the biggest problem in the city back in 2000. And again, paying attention to it, we now see the lowest level of children being tested with elevated lead levels in there for children under 6. But again, hopefully the point of the data is to show we're not quite there yet in all of our neighborhoods. And this not only impacts, obviously, children, unfortunately, in terms of health, this impacts a whole bunch of other systemic issues with respect to the housing market. Can you even sell a house? In some cases, can you even put in your digital access line? Can Comcast come into your house or apartment and actually put in that physical wired line? In some cases, they couldn't do it because the landlord didn't want to open up the possibility of a lead paint violation. And so even though there was technically free access to digital resources in some of our neighborhoods, it still was a barrier because of lead paint. So this is the kind of data that we can see how they're interrelated with some of the other issues, which I'm going to talk about in a minute. We did have new data for 2019, which is how many people were on supplemental nutrition assistance program, or the SNAP program. This is actually a new indicator for 2019. We're going to see what happened in 2020 when this data comes out. We don't know where we were before this is the actual data from the Maryland Department of Human Resources. So this is not just people saying that they're using SNAP, but this is actual claims for SNAP. So that's one of the differences between this data and maybe data that you might see on the census. So this is the actual claims versus just self-reporting. The other good news leading into the pandemic, again, we had the lowest unemployment rate of a decade in 2019. There was really good news in terms of unemployment leading from 2016 down, but it didn't evenly impact everybody, even though as a city as a whole, we saw the lowest level of unemployment. And this is a conversation about equity, right? In terms of unemployment, you can see where we have high rates of unemployment in the city, in this west side, the east side, coming up in here into the northeast in the Southern Park Heights area, and a little bit in the south. And unfortunately, these areas are all, in terms of racial equity, all high rates of African-American households, but not exclusively, right? We have lots of high rates of African-American households way out into the west. This is what Dr. Brown calls the black butterfly. Dr. Brown from Morgan State University calls our black butterfly of the city, where we have predominantly African-American households in the wings of our city and predominantly non-African-American households in kind of the middle and going around the water. But in terms of unemployment, we can see that it is disproportionately impacting neighborhoods with high African-American populations. And not necessarily that low unemployment rate didn't necessarily penetrate everywhere. In terms of housing equity, the unemployment rate and vacancy is almost a 90% correlation between which neighborhoods have high vacancy rates, high housing vacancy. And again, even though housing vacancy is the lowest it's been in a decade, not distributed evenly everywhere. And then of course, in terms of digital equity, this is coming into the pandemic in 2019, the number of and the rate of people that had no access to the internet. Sorry, my mouse is very tricky here. So high rates of unemployment and high rates of no access to the internet at home. And so when the pandemic happened, in these neighborhoods with high rates of no access to the internet at home, this becomes a big issue for children going to school, for people trying to work remotely and maybe not being able to do that because there's no way to do that at home. And then even trying to look for a job, look for unemployment benefits, having to do all of that, as we all know, doing that all online, again, becomes a digital equity issue in terms of moving forward in the pandemic, post-pandemic now. And then finally, we have mobility equity. We know that our unemployment rate is heavily correlated with the lack of transportation and transit into some of these neighborhoods that could either get workers from their home to a job or get people into the neighborhood to take a job. So I'm going to talk about businesses in a minute because the unemployment rate and lack of businesses is also highly correlated. But this 45-minute commute time is something that we've talked about before. But the reason why this is such a problem, because in the middle of a city, having that kind of a high commute time essentially is an urban disamenity. And having an urban disamenity in our city is going to keep people from coming back if we don't address this issue. And we can see that it's not just about spatial location. So the city of Baltimore in general has seen a creeping up of that 45-minute commute time slowly as a city overall. But we have two neighborhoods that are right next door to each other, Upton and Sandtown Winchester. They started off the decade at about the same rate. And we have Upton coming down in terms of the commute time rate, and Sandtown Winchester staying about the same, even though they're right next door to each other. And we unfortunately see kind of the wrong trend in Southern Park Heights, which is just a little bit further northwest of this part of town. And we can see that now Southern Park Heights is our highest 45-minute commute time. One of the benefits of having open data is that these are the trends and the visualizations that we're able to show you. But every day this week, we are going to promote and highlight how people are using our data, our open data portal, for their own analysis. And we hope maybe someday one of you will become some of our renegade DIY data analysts yourself using our open data resources. And so today's promotion is with Omar Abbasi, and you can see his link on our Facebook and Twitter pages if you're interested. But notice what he has done is taken everything that I just mentioned about that 45-minute commute time and combined both of those issues, high African-American rates, high commute time, and where they're located. And so you can see that this high commute time is disproportionately not only impacting those neighborhoods of distress that I mentioned, but obviously impacting neighborhoods with high levels of African American. And so this is the point of the open data, is that we can all kind of take a bite of that elephant of what is happening in our city. And so we encourage you this week even to kind of test your hand on looking at the data and analyzing it for your own purposes. So what are the key indicators to watch post-pandemic? And what key indicators to watch is obviously based on our own framework. We had to identify in the last couple of years, particularly after the uprising in 2015, after Freddie Gray, we had to decide if we were going to be an organization that led with a point of view. We want to be able to not just put out data, but since we're staring at this data all the time, it's kind of like we have a stethoscope on all of our neighborhoods all the time. And if we're seeing something, we should basically say something, right? And so we wanted to make sure that we hold ourselves accountable for some of the trends that we're seeing in our neighborhood. So if we're seeing a disturbing trend, we will go to that neighborhood leader and neighborhood organization community meeting and say, hey, you know, here's all of your indicators, but here's one that's kind of leading in the wrong direction. So for example, in that Park Heights, where they are now the highest rate of this neighborhood with the 45-minute commute time, we went to their community association meeting to show them that this is now a current reality for them. And it wasn't like they didn't know, it just provided data for them to be armed with actually addressing the issue in the future. So if you're going to be an organization now that leads with this point of view, what we did was try to really synthesize all the work, and that's our job, is to try and put this all together for you in presentations like this. This is called the State of the Neighborhood briefing. We do this briefing all the time to any organization that might be interested. And we do now work with all kinds of folks, many of you in the audience today, but we work with the media, we work with advocates, we work with legislators, we work with nonprofits, anybody that's going to help move along some of the key indicators that we found to be a barrier for a just and equitable city, which is what we're hopefully all after. So we wanted to make sure that whatever we do has a sustainable point of view for the long run. And we've focused in on the fact that our data is the voice of the neighborhoods themselves. People, businesses might come and go from a neighborhood, but the neighborhood cannot physically move anywhere. And so our data is meant to really show the context that people are living in. And in general, there is no way that neighborhoods can remain separate but equal. No policy across any domain is going to hit the same neighborhood, hit two different neighborhoods the same way, because of the nature of how the indicators are functioning in those neighborhoods. So it's just like if you and I both took the same medication, it would impact me different than you because we have two different physiologies. And you can think of our neighborhoods the same way. So policies need to have a neighborhood lens so that you can potentially see, is your policy going to reduce neighborhood disparity? Because if it doesn't reduce neighborhood disparity, it's not going to reduce all of the other disparities that we care about: racial disparity, health disparity, education disparity, and on and on and on. Because the neighborhoods themselves have this kind of disparate outcomes and disparate realities, policies have to take that into account. And that's what our kind of long-term point of view is all about. And so we need to go upstream in the decision-making process so the data can be useful before we see the unequitable outcomes that our maps essentially relate. We need to kind of get to all of you as we make decisions, elected officials, community organizations, advocates, the media. We want to be where you are when you are making a decision to see if what you're planning on implementing or planning on doing can break through the neighborhood disparity that our data is showing. And so after kind of doing this kind of work for the last 5 or 6 years to do that synthesis, we now have a key set of frameworks. We have 4 goals that we want every neighborhood to to really think about this moving out of the pandemic. First of all, are people moving in or are people moving out? And we're going to find out more when the 2020 census comes out in a few months. We want to make sure that every neighborhood has increasing diversity in terms of its housing stock. Is it affordable? Is the housing stock in your neighborhood affordable to a broad range of people? And we suggest for every neighborhood to track their owner occupancy rate, the rent affordability, and housing voucher use. We want to make sure that every neighborhood is below 4% vacancy. It's a way to set a goal. And so I showed you some of the vacancy indicators already, but the other one that we tell communities to track is your no mail households. We want to ensure that every access and mobility within and to every neighborhood. And so we obviously showed the 45-minute commute time, which is a real disparity for our neighborhoods, as well as we have another indicator of where and who is using the bus system, which is our major source of transit in the city of Baltimore. And then finally, we want to measure connectedness, because connectedness is the way we have access to opportunity. And opportunity digitally, investment in terms of capital, socially, and then of course physically too, in terms of making sure you can get access to the region, no matter what neighborhood you live in. You need to be having access to the rest of the world, and that's what we want to be the case for all of our neighborhoods. So we went through a couple of these indicators, but these are the 10 indicators that we suggest for every neighborhood to keep track of over time. And if you see some disparity, that these are the kinds of things that you want to try and address. And this is why. So you've seen this probably before, that in the last decade, the city of Baltimore was the only city on the East Coast that continued to lose population. And this is sadly kind of the tale of two diverging cities, right? Baltimore versus DC. DC right to the south of us, 45 minutes to the south. You can see over the last 30 years that the job growth in DC has outpaced us by far, and we have been declining in terms of jobs in the last 20 years. And because of the lack of jobs is precisely why we're losing population. The reason why people go anywhere is so that they have a job. That's the number one reason why people choose where they go to live. But we have a spatial mismatch. So you can see where we have businesses in the city. Again, 2019 data, this is all in Vital Signs 2019. Where we have businesses are coming, into the center, which makes sense. We have a downtown, we have the hospital here in this east neighborhood. We have Bayview out way into the east. And so this is where we predominantly have businesses in general. But notice if you live in the city of Baltimore, we have lots of people that work outside the city of Baltimore. So those jobs are not necessarily being taken up by all of us living in the city. Although you can see one of the benefits of living in this central region is that people do live and work in their neighborhood. And that's one of the amenities of living in a city. In order to get more jobs in some of our neighborhoods, we actually need to invest in small businesses that might eventually become big businesses. And unfortunately, we see a pretty unequal distribution of investment that could lead to future jobs into our neighborhoods. And this is something that we're tracking thanks to the 21st Century Cities Initiative at Johns Hopkins, and thanks to them for essentially giving us this indicator year over year so that we can track it. So now you can also track what level of investment are you getting in your neighborhood to focus in on small businesses that could potentially eventually not only lead to jobs in your own neighborhood, but potentially lead to bigger businesses for our city. The other thing in 2019 is that we can look at where jobs and income are related. We have highest incomes in the north part of the city and coming around the water. And for those of you that have been in Baltimore for a long time, we can see these huge increases in income in that peninsula area and around the water. And for the first time, Canton in 2019, Canton is our #1 median income neighborhood, which is surpassing kind of North Baltimore, Guilford, and Greater Roland Park, which are historically our highest income neighborhoods. So Canton and South Baltimore, which includes essentially the Locust Point and South Baltimore Peninsula, are now our highest income neighborhoods. Sorry about that. This is something that we've basically watched happen in Canton over the last 20 years that we've been tracking the data. We kind of slowly watched it become our highest median income neighborhood. And in terms of thinking about how that's going to relate to future investment in our neighborhoods, one of the things, this is a new indicator for us, again, leading into 2019, where was it possible to even get a mortgage in some of our neighborhoods? And unfortunately, this tracks with income, with sales price. Where we have high sales prices, we're getting lots of people with a mortgage. And unfortunately, a pretty big swing, a 20 to 30 point swing in percentage of people in that neighborhood that applied for a mortgage and were approved or denied. So this is the approved rate. And you can see neighborhoods where this is among the people in that neighborhood that even applied for a mortgage. There's a whole bunch of work that we need to do to understand why this might be true. And that is what we want to work with advocates now to try and figure out, can we change this? Otherwise, we will have continued disparity in the housing market and the ability for people to gain equity through their house in some of our neighborhoods if we cannot equitably distribute where and how people are getting mortgages. All right, so that's a little survey of where kind of you might want to take a look at some of the indicators to think about during, pre, and post-pandemic. But we at the Baltimore Neighborhood Indicators Alliance are preparing for the eventual release of the 2020 census data. So one thing that happens every decennial census is that we are going to think about how our neighborhoods are named. And after today's session, you will receive a survey to think through with us how we might change some of the neighborhood names. The boundaries are not going to change for those of you that are researchers. The boundaries are conflated to census tract boundaries. And so we know, are not going to change with the 2020 census. But we have the opportunity as we prepare for Vital Signs 20, we're already preparing for Vital Signs 20, to think about making sure that the neighborhood names reflect what neighborhoods actually want their neighborhoods to be called. We've gotten lots of complaints for the last 20 years of some of our neighborhoods. And so now is the time to make adjustments. So that's where we're going. That's where we're headed. And this is where you are hopefully going to stay with us for the rest of the week. You can see the full set of events, and these are our 2 hybrid sessions. If you are interested in coming in person during these sessions, we have very limited opportunity, obviously, to maintain social distance indoors. So if you are interested, just let us know in the chat and we'll send you a link to that. What is up with Vital Signs 19? I'm so excited to be able to share that we have an amazing connection now with the Open Baltimore data portal, that if you went to Open Baltimore, if you come to our open data portal, the data that you see for Baltimore Neighborhood Indicators Alliance and the Vital Signs data is going to be concurrent. So if we push out anything on our open data portal, it automatically goes to Open Baltimore. And I think that's actually pretty unique among all of our neighborhood indicator partnership cities, the 30 that I talked about at the beginning. We're probably the only one in the country where this is true. So that's exciting news. And Cheryl is going to do a great job in showing you how to use our open data portal. So I'm going to stop sharing, answer some questions while she gets set up to show you the open data portal and show you how to get there from our main website. And again, thanks to everybody for being here.
All right. So we did have a couple good questions and remarks in the chat. So I don't know if Seema would like to address some of those, but the one remark that Dexter made, really agree with, wishing that the census collected data on wealth in addition to income, and thinking through what that might mean for different communities in Baltimore, you know, a Roland Park versus a Canton. So if folks have questions, please feel free to drop those into the chat. We are a little bit limited on time. I know there's a lot of information that Seema just presented that will take a little bit of time for it to sink in. And I'd also like to use this as an opportunity to just remind folks that the session is being recorded. So if you're like me, want to go back, revisit some of the points that Seema was presenting in her talk today, we will be sharing this on our YouTube channel, which is just BNIA JFI. So if we don't have any questions, I guess I'll do a quick launch into ways of accessing our data and our information. And I do see that Jay has his hand raised.
You will have to put your question in the chat. And please feel free to address your question to both panelists and attendees. If it's just panelists, it'll just come to me, which I'm happy to see. But if you send it to the attendees as well, then everybody can see.
Okay, so thank you, Jay. So how many actual lead cases were in the city? So this is something that we do track. So we have a partnership and the ability to get data around children that have been tested and that have elevated blood lead levels. So that's something that we can both explore on our website to get you that number, as well as on our open data portal. So we make this data open and available to a lot of different folks. And so we realize that we have a variety of different types of users of our data and our information. So we know that there's certainly some folks that would love to just pop onto the website, grab a quick number, be able to use that number for a grant application that they're working on to bring up in a community association meeting. And then there's other folks who are more advanced data users who would love to access our data so that they can do more robust spatial analyses to create open data visualizations using the information that we push out there. So we try to address all of our different data users through the website and through the open data portal. So right now I'm sharing our homepage, so that's just bniajfi.org. And here we have all of the data points that Seema was describing. So we have data that is through 2019 and in some cases 2020. And when you come to our website, you can view that data by community. So you can select a neighborhood either on the map or through a dropdown. You can view by a topic area, or you can also view by a indicator name and just do a quick search that way. So I'm just going to do a keyword search for that elevated blood lead. And so again, as I mentioned, we have a number and a percentage. And when we go to our landing page, it will then pull up data for Baltimore City, as well as our 55 community statistical areas. And so on our website, as well as the open data portal, we have a description of what each indicator is, how we organize it under our 8 different topic areas, the source, so where we're getting this information, and then the years that we have it available, as well as a quick definition. So for the most recent year of data, so for 2019, we have that over 15,000 youth aged infant, newborn to 6, 15,526 children were tested for elevated blood lead levels. So we've got the data here, as I mentioned. This is just a quick tabular view. You can do a few things with this data. You can copy it, you can download it to Excel or PDF, you can print it out. We have different ways of visualizing the data, indicator maps as well. All of this on our main page. And again, you can explore all this data through our vital signs, either again by community, by topic, so in this case, children and family health, or you can do a quick zoom directly to that particular indicator doing a keyword search. So in addition to finding the data here, we have the same exact data points published to the open data portal, and that is accessible back on our main page. So we have a URL that will go to all of our open data portals. So as Seema was mentioning earlier, we have one for the vital signs data, but then we also have one for our COVID data. So this is something that we were putting together last year. So on this portal here, you have access to all of the different projects that we've been working on. But down on this left-hand side, this is where I'm really going to be focusing in this Vital Signs Open Data Portal. And so when you pull this up, you have a lot of bits and pieces of information at your fingertips. So for each of our vital signs reports every year, every spring as we're releasing data, we put together a narrative that describes the trends that we're seeing. So we have the 8 different topic areas of vital signs, as well as an introduction. And one of the first things that you can see when you come to our open data portal is this top-hand navigation that allows you to really quickly go to that narrative so you can read about the trends that are impacting Baltimore's communities. As you scroll down, again, we have a couple different ways of getting to this data and information. You can do a keyword search by name in our search box, or you can also browse through all the indicators that are in each of our 8 different topic areas. We also have these links back down here to those chapter narratives. And then as we were releasing data this year for Vital Signs 19 with the 2019 and 2020 data, we were also hosting some webinars. So we have some videos here if you would like to see these really good in-depth videos that discuss some of the trends as we were releasing them. But I'm going to scroll back up and I'm going to go to, again, that blood level question. So I'm going to just type in a keyword search for lead, and I'm going to select this first one. So in this case, this is the percentage of children age 0 to 6. So those are the ones that were tested that had elevated blood lead. So when you do a search, it will bring you to a landing page. And so this landing page has then a lot of information, again, about the name of the statistic, so what it is that we're measuring, a summary, so a definition of what exactly this indicator details. And then as you scroll down, we have additional information, such as when we last updated it, when it was originally published. And then you will also see down here 2 layers. So what we do is we publish data for our 55 community statistical areas for all years. So we have our data available starting in 2010 through either 2019 in this case, or in some cases for other data sets, 2020. And then we also have a value that is just for Baltimore City. And so you can click on either community statistical area or you can click on city to learn a little bit more about the data at those geographic levels. So I clicked on data at the community statistical area, and it'll take a second, but it will then populate a map that is in this main pane here. So thankfully, in the case of Baltimore City, not every community statistical area had a value of children that had tested positive. But either way, we've got this map here that you can browse, you can explore the data. And if you'd rather not click on a map to get a little pop-up that tells you a little bit about it. So here we have a lot of zeros. Thankfully, in that community statistical area I clicked on, we have this button in the upper right-hand corner, View Table. That will allow you to go to a tabular view of the data so that you can see communities that have had children testing positive for elevated blood lead levels. I'm going to click back in this upper right-hand corner to close that out, back to the map view. So with this data, you can do a few different things. You can filter the data. So we have these little tool buttons here, kind of on the left-hand side, that allow you to filter data by year. So if you wanted to select an indicator at a certain range, you can do so, and it will also update the map. The map can also be styled. So right now we have everything kind of set to a solid blue. You can select a year, and it will automatically create a map that then updates and will display the values. So sometimes it will take a quick little second for some of these data pieces to come in. And so all of this data can be downloaded. So we've got this little cloud icon here. When you hover over it, it says download. You can click on that and you'll have a few different ways that you can download and use this information. So you can download the data to a CSV, which is great if you wanted to pull it into Excel, or if you wanted to pull it into a statistical package, KML, shapefile. So this is if you are using GIS software to make maps. We also have GeoJSON formats. And then there's a few other things that you can do with this data as well. So just going to click on that more info, that I. Down here, we have this little cool button here that says, I want to use this. So if you click on that button, you're then able to take this data that we have published and you can make visualizations with it. So making maps, different tools to allow you to create visualizations using ArcGIS Online. And if you're a developer, if you want to play around with the API, we have different tools that will allow you to make different visualizations on your own platform for this data. And then we also have source information, metadata, and so on and so forth. So this open data portal is just a great way of interactively exploring a lot of these data sets. We have data that, as I mentioned, goes back to 2010 and in some cases all the way through 2000. And it's hopefully another way to think about what the data is showing you and to allow you the opportunities to unlock this data and information so that you can use it to create meaningful visualizations. So we just have a few minutes left in our session. So I'm going to stop right here. I've been seeing the chat window lighting up a little bit. So I know that we will have a few folks that might want to share some additional thoughts, or if we have some additional questions, we'd be happy to kind of go over those. But again, this is just another way for advanced users to access our data on our website. We also have, as I mentioned, the same exact data published on our website for other users who would rather just be able to have a quick visual representation, grab a number off the website. I know I certainly do that myself. So thanks again, everyone, for joining us. We really appreciate you sticking with us. Sometimes Mondays are rough. So hopefully this is some useful information about accessing the BINIA data and how it can be used to advocate for real change in Baltimore's neighborhoods.
Thanks, Cheryl. So we had some great questions in the chat, which we did try and answer in the chat, but also try and answer them. The one global question was, how do we source our data, or how do we curate what data we even put in here, which is a great question. And then Cheryl, I thought you could probably answer TJ's question specifically about Park Heights and Park Circle, or Logan. You might be able to do that too. So in general, where do we get our data? And this is kind of at the genesis of where we started as an organization back in 2000. The idea was that, and again, before anybody had the moniker open data or big data even came on the scene, it became clear that in the 1990s, a lot of the interactions that we were starting to have with our own government became more electronic. It used to be that you'd go downtown, fill out a piece of paper, maybe put in a form, and those forms and binders of paper, if everybody remembers those, that was how the city had data. And in the 1990s, we had many more databases being created. In some cases, not the same databases, like DPW would be using one database and housing would be using another. And these databases didn't talk to each other. And so the question was, could we basically take data that the city itself is collecting through the interactions, the e-government interactions that they're having with their own citizens, and use that to more effectively track what is happening in our neighborhoods? Well, 20 years later, this is not a new idea, right? This is actually very common for cities to put out data so that people can see what is happening in their neighborhoods. But when we started, the idea was to take basically any kind of electronic data that any agency might have, integrate it using some type of interoperational standardization process, which we use using geographic information systems and standardizing addresses and standardizing geocoding processes, and then put it out. So you could see in one neighborhood, here's your crime rate, here's your sales price, here's the number of trees that were planted in Southern Park Heights, for example. And you can see all these different agencies that might have information and put them together, because really for neighborhoods, they see all of that, right? We all have every issue in every neighborhood. It's not that we only think about crime and we only think about housing prices and we only think about how many kids are going to school or what our lead paint levels are. We all in every neighborhood actually have to think about all of them, but agencies aren't necessarily organized that way, right? Agencies think in terms of the thing that they're doing. Transportation is doing transportation and DPW is doing public works. And so the point is to really think about ways to integrate. So our data is essentially your data. It's data that you have essentially created through interaction with your own government or our own government. And that's, I think, been a real benefit for the Baltimore Neighborhood Indicators Alliance, is that we are putting back out data that you yourself are in, right? If you call 311, you're in that data, not literally in, we aren't going to show any one person that's actually called 311, but we in the aggregate show that all of these people in your neighborhood called 311. And so every single data point that we put back out on the vital signs report is of our own people, of our own neighborhoods, of things that are going on in our own city. And so if we have to go back and look at the genesis of the data, where are we going? We're going back to our own government. And this, I think, has been the real benefit of BNIA, is connecting neighborhoods to what information their own government has in a way that they can understand. The government has plenty of information that they use for planning purposes and decision-making and administrative purposes and legal purposes. But to put it back out for communities to kind of have an interaction with its own government, I think has been the greatest thing that I've seen of the utility of the data and the focus that we have on what's called administrative data sets. Very long-winded answer for a very simple question of how do you curate data, but I feel like it's at the crux of our own democracy to open up data this way, because it is any list that any agency has, we're going to be on the prowl for. We try and actually look for data that cities might be newly collecting so that we can push it back out for neighborhoods. All right, so in the chat, we do have some things that we could use from you. We have the evaluation for this session. We have links to future sessions if you want. And if you are interested in joining us again for those hybrid sessions, the links are there as well. Is there any question that I can answer in here quickly? So if you please can fill out the evaluation form, it's in the chat. We can use that to make sure that we're doing a good job with the series of events. So we had some suggestions that you all want to get to know each other. Yes, I know in a webinar that's a little hard. But if you are interested in getting to know each other, feel free to put your information in the chat and people can reach out to you. Yeah, we have, thanks Alex, but we have a ton of education data. If you do nothing less, we do have both 2019 and 2020 education data. So please do look at that. If you look at nothing else, look at the school switching information of which neighborhood had lots of children switching schools in the middle of the school year. A very telling indicator about destabilization in education, as children unfortunately have housing insecurity issues or other insecurity issues and have to switch in the middle of a year. So I guess, what is it, the pro tip, if you look at no other indicator in the education, look at school switching. Thank you all very much for being for the very first session. There are 10 more to go. We hope to see you throughout the week and maybe even in person towards the end of the week. And thanks again to my team. Thanks again to the sponsors and so many partners. And we look forward to seeing all of you during Baltimore Data Week.